There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disorder in which the body does not produce insulin, a hormone that regulates blood sugar levels. Type 2 diabetes is the more common form, and it occurs when the body does not properly use insulin or does not make enough insulin. Weight loss can be an effective way to manage type 2 diabetes. When you lose weight, especially in the abdominal area, your body becomes better at using insulin, which helps to lower blood sugar levels. Additionally, losing weight can help lower blood pressure and improve cholesterol levels, which can reduce the risk of diabetes-related complications such as heart disease and stroke. Importance of diet. Diet plays a crucial role in the management of diabetes. Proper nutrition can help control blood sugar levels, manage weight, and reduce the risk of complications associated with the disease. A diet for diabetes management typically includes a balance of carbohydrates, protein, and healthy fats, and is often low in added sugars and saturated fats. It is also important for individuals with diabetes to monitor their portion sizes and track their intake of carbohydrates, which can have a significant impact on blood sugar levels. Additionally, regular physical activity and maintaining a healthy weight are important components of diabetes management, and can be supported by a balanced diet. Some recommendations for healthy foods and meal planning for diabetes management. Fruits and vegetables. Include a variety of colorful fruits and vegetables in your diet, as they are rich in vitamins, minerals, and fiber. Whole grains. Choose whole grains such as quinoa, brown rice, and whole wheat bread, as they are high in fiber and can help regulate blood sugar levels. Lean protein. Include lean protein sources such as fish, chicken, tofu, and legumes in your diet. Healthy fats. Incorporate healthy fats such as olive oil, avocado, and nuts into your diet. Limit added sugars and saturated fats. Avoid foods that are high in added sugars and saturated fats, such as sugary drinks, baked goods, and processed foods. Meal planning. Plan your meals and snacks in advance to ensure that they are balanced and include a variety of nutrient-rich foods. Carbohydrate counting. Consider counting the number of carbohydrates in each meal and snack to help control blood sugar levels. Consult a dietitian or healthcare professional who can help create a personalized meal plan that takes into account their individual needs, dietary preferences, and any other medical conditions. Regular physical activity is an important aspect of diabetes management. It can help control blood sugar levels, manage weight, and reduce the risk of complications associated with the disease. Here are some benefits of regular exercise for diabetes management. For permanent solution, check out the description. Improved glucose control. Regular physical activity can increase insulin sensitivity, which helps the body use insulin more effectively, leading to better glucose control. Weight management. Exercise can help burn calories and promote weight loss, which can improve insulin sensitivity and glucose control. Reduced risk of cardiovascular disease. Diabetes increases the risk of cardiovascular disease. Regular physical activity can help lower this risk by decreasing blood pressure, improving cholesterol levels, and reducing inflammation. Improved mental health. Exercise has been shown to improve mood and reduce symptoms of stress and anxiety. Increased energy levels. Regular physical activity can improve overall fitness, which can lead to increased energy levels. Better sleep. Regular physical activity can improve the quality of sleep and lead to better sleep patterns. The general recommendation for adults is to engage in moderate intensity aerobic activity for at least 150 minutes per week, or 30 minutes a day, 5 days a week. But also include resistance training and stretching at least 2 days a week. Medication and insulin therapy. Medication and insulin therapy are commonly used to help manage blood sugar levels in individuals with diabetes. Medications such as metformin, sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors work by increasing the body's sensitivity to insulin, reducing the amount of glucose produced by the liver, or slowing down the absorption of glucose from the intestines. These medications can help control blood sugar levels, but they should be used in conjunction with a healthy diet and regular physical activity. Insulin therapy is typically used for individuals with type 1 diabetes or those with type 2 diabetes who are unable to control their blood sugar levels with other medications. Insulin is a hormone that helps the body use glucose for energy. Insulin therapy can be administered through injections or an insulin pump. The type, dose, and frequency of insulin therapy will depend on an individual's specific needs and will be determined by a healthcare professional. It's important to note that medication and insulin therapy should be used in conjunction with a healthy diet and regular physical activity, and that blood sugar levels should be regularly monitored to ensure that therapy is effective. Regular monitoring of blood sugar levels, through self-monitoring of blood glucose, SMBG, or continuous glucose monitoring, CGM, can help adjust medication and insulin doses and make adjustments to diet and physical activity. How to regularly monitor blood sugar levels. Self-monitoring of blood glucose, SMBG. This involves using a glucose meter to test a drop of blood from a finger prick. The meter then displays the blood sugar level. Individuals with diabetes should consult a healthcare professional to determine how often and at what times of day they should test their blood sugar levels. Continuous glucose monitoring, CGM. This involves wearing a small sensor under the skin that continuously measures glucose levels in the interstitial fluid. A transmitter worn on the skin sends the glucose readings to a receiver, usually a smartwatch, a phone, or a dedicated monitor. This allows for continuous monitoring of glucose levels and can provide alerts for high or low blood sugar levels, and some devices can also show the trend of glucose levels and provide insulin dosing recommendations. HbA1c test. This test, also known as hemoglobin A1c, measures the average blood sugar level over the past 2 to 3 months. It is typically done in a clinical setting and does not require fasting. It's important to regularly monitor blood sugar levels, as they can fluctuate throughout the day and can be affected by factors such as diet, physical activity, stress, and medications. Individuals with diabetes should consult a healthcare professional to determine how often and at what times of day they should test their blood sugar levels, and how to interpret the results. It's also important to note that regular visits with a healthcare provider, such as an endocrinologist, primary care physician, or diabetes educator, are important to evaluate the overall management of diabetes, including monitoring blood sugar levels, adjusting medications and insulin doses, and addressing any complications. The importance of support and resources for sticking to a weight loss plan. Support and resources are essential for success in weight loss and diabetes management. Joining a support group, working with a registered dietitian, and consulting with a certified diabetes educator are all great ways to gain the support and knowledge you need to achieve your goals. Additionally, it is important to have a clear plan in place that includes healthy eating, regular physical activity, and monitoring your progress. Here are a few final tips for success. Set realistic and achievable goals. Don't set yourself up for failure by setting unrealistic goals. Start with small, achievable goals and gradually build up to bigger ones. Keep a food diary. Recording what you eat can help you become more aware of your eating habits and make it easier to identify areas that need improvement. Stay active. Regular physical activity is essential for weight loss and diabetes management. Aim for at least 30 minutes of moderate intensity activity most days of the week. Be consistent. Weight loss and diabetes management are long-term commitments, so consistency is key. Try to stick to your plan as best as you can and don't get discouraged by setbacks. Keep track of your progress. Keep track of your weight, blood sugar levels, and other relevant measurements to monitor your progress and make adjustments to your plan as needed. Don't hesitate to seek professional help. If you need help, don't hesitate to seek it. Your healthcare provider, dietitian, and diabetes educator can all provide valuable support and guidance. Remember that weight loss and diabetes management are ongoing processes, and it's important to be patient with yourself and to celebrate your small wins along the way. If you want to stay informed and motivated on your weight loss and diabetes management journey, please like and subscribe to this channel.